But let's stick with this issue and lockdowns and restrictions and how we're dealing them, and catch up with psychologist Clare Rowe again, who joins us. I haven't spoken to you for a long while, Clare, so great to talk to you again. We've talked before about the impact of lockdowns and isolation on people and families and children. You must be very concerned about people in Melbourne in particular and Mitchell Shire who, having got through this once and sort of tasted a little bit of freedom, if you like, there's a weight off everyone's shoulders as we started to re-engage, to be forced back into that situation again.
Yeah, thanks, Chris. I am. It doesn't take a rocket scientist to see that this pandemic is going to have very, I would say, severe effects on our mental health as a nation. I mean, it's got everything that we know are red flags for the deteriorating mental health. That is a loss of routine, job insecurity, housing insecurity, loss of relationships. Dare I say it, and I know that this may be a strange term to use, but I think going into a second lockdown, the novelty factor has well and truly worn off. So, I mean, I was even one for spruiking the positive effects of sometimes of families reconnecting during lockdown periods. There was a slower pace of life. People returned to the kitchen. Kids were getting time with families. There were some nice benefits to it. And now I see a lot of frustration, hopelessness, boredom, and quite frankly, kind of despair. And I think that worry now setting in, what happens every time we emerge from lockdown? I think there was that kind of jubilation of returning, of this is great, we've beaten this, and it's literally a step backwards for people thinking, oh dear, how are we going to just come in and out of lockdowns?
Look, I think what you said makes enormous sense. We all know that first lockdown, there was a sort of an esprit de corps right across the country. People were all in this together. Well, lockdown, we'll try and have some fun with it and have a joke about how it's all doing. But I'm not in Melbourne, but I've been in touch with a whole range of friends in Melbourne over the last week, all walks of life. And it's different for them this time. They feel frustrated, even angry that they're having to do with this. And also, of course, a great deal of uncertainty about, what's next.
Yeah, absolutely. And for Sydney-siders in my clinic that I'm seeing, I mean, people walk in the door, or I'm still seeing people on Zoom, and the first comment people will make is, are we going to be like Melbourne? Oh, let's hope we're not like Melbourne. So, even for people around the nation, we're watching, we're waiting, and it's that kind of letdown that, oh, it didn't work and we've got to do it again. And we're kind of, yes, it's not the same kind of call to arms that we all had initially. So It's very hard. It's, there's some emerging evidence now coming out of the UK of the effects on the rise of mental health conditions over there. And of course, they're a lot worse than us. But, the number one thing adults are citing is worry about the future. And yes, it's the future of 10 years' time, but it's the future of the next 6 months. And that yo-yo effect of, is this what we're going to be forced to do, to kind of come in out of lockdown every 2 to 3 months?
Now, we've talked a lot about children's issues. You do a lot of work with children. Kids have been through remote learning and learning at home and all of that. They know that this experience is unusual. They know the disease is a threat. My experience with a lot of young kids, as you know, I've got young kids myself, is that they've got a pretty good attitude. They understand, they don't think they're dealing with Ebola. They've been well educated about the risks here and the fact that they're in the clear. Tell us about what sort of anxiety issues you're seeing with kids and what parents should be doing, I suppose, parents and grandparents, to help kids get through all this.
Chris, I have to say I've been really surprised at the lower rates than what would be expected of clinical ranges of anxiety with children during this. So the children I'm seeing who are really struggling certainly had pre-existing anxiety conditions that made them vulnerable to this before. They were already worried about illness, catching germs. They were already kind of obsessively hand washing. And those are kids that are absolutely going to be vulnerable in a state like this, where we've now got signs around every public place to wash their hands. So that they've gone backwards in their health conditions. But look, for the average child I'm seeing, they're actually dealing with it extremely well. Most of them are worried about having to go to school now for 10 weeks for term 3, and they're thinking, oh my goodness, that's going to be a long term compared to term 1 and 2. So they're thinking, oh my goodness, how are we going to get through that? But other than that, I've been quite buoyed at how children have taken this. I think parents, you need to put things quite simply and say that this is something that we're all treating and these are the things that you can do, but otherwise when we're maintaining our routine with schoolwork and etc. as normal, and we just take these precautions, but life goes on and we don't make a massive deal with it, particularly to primary school age children or below. I'm a little concerned at the teaching of coronavirus terms to preschool children. I have preschool children myself. They have come home questioning me if I have coronavirus. They know all about it. I don't think that's necessary. I think some lessons about hygiene for 3-year-olds are quite sufficient.
Yeah, very well said. Good to talk to you again, Claire. I appreciate it.
Thanks, Chris.
Clare Rowe there, who's a psychologist. As you heard, this affects different people in different ways. Good to hear that most kids are dealing with it pretty well. I've certainly experienced that myself. I think one of the worst things for kids is missing out on contact with their friends at school or in organised sport.